Welcome to this week's edition of Hematology and Blood Cancer Updates, covering the latest breakthroughs. Brought to you by LucidQuest, CellCentric has dosed first patients with inobrodib plus BCMA bispecifics in relapsed or refractory multiple myeloma. Phase 1, Phase 2 cohorts test inobrodib with teclistamab or elranatamab in approximately 40 patients, with an initial safety readout expected by the end of 2025. Inobrodib is a first-in-class oral P300CBP inhibitor targeting MYC and IRF4 programs. Cilta-cel shows a compelling long-term signal in multiple myeloma. In CARTITUDE-1, 32 of 37 patients remain alive and progression-free at or beyond 5 years after a single infusion. 12 patients sustained complete response, remained MRD negative and PET-CT negative for 5 years, and required no maintenance. Median overall survival reached 60.7 months in a heavily pretreated population. Lyell has initiated a head-to-head Phase 3 of RONDE-CEL, a dual CD19-CD20 CAR-T versus axi-cel or liso-cel in second-line large B-cell lymphoma. About 400 patients are planned. Event-free survival is the primary endpoint. The program holds RMAT and FastTrack designations, includes an outpatient option, and expects enrollment to begin by early 2026. Epcoritamab demonstrates outpatient feasibility and strong activity in relapsed or refractory DLBCL. 92% received the first full 48 milligrams subcutaneous dose as outpatients. Cytokine release syndrome was grade 1-2 only. ICANS occurred in 7.6%, was low grade, and resolved. After one prior line, among 42 patients, ORR was 64.3%, with 47.6% complete responses at a median follow-up of 5.8 months. After 2 or more prior lines, among 50 patients, ORR was 60.0%, with 38.0% complete responses at 10.8 months. In Singapore, orelabrutinib has been approved for relapsed or refractory marginal zone lymphoma. This is its second indication in the country, addressing an unmet need and supporting broader global expansion. Senhwa's CX-5461, also known as pidnarulex, a first-in-class G-quadruplex stabilizer, has IND clearance for Phase 1b Phase 2 evaluation in MYC-driven B-cell lymphomas. Given MYC alterations in approximately 28 to 30% of tumors, the agent may have pan-cancer potential. CERo's CE-R1236 has received FDA Fast Track in acute myeloid leukemia, adding to orphan drug designation. The ongoing first-in-human Phase 1, Phase 1b includes relapsed or refractory AML, MRD-positive AML, and TP53 mutated MDS or AML, using a CERT platform that induces phagocytic engulfment distinct from CAR-T. In India, the BBCI National Conference spotlighted advances in AML care, including risk stratification, NGS and flow MRD, novel agents, transplant strategies, and supportive care. Emphasis was placed on early diagnosis, timely referrals, and equitable access. More than 90 postgraduate delegates attended alongside faculty from leading centers. The FDA has extended the PDUFA date for Pyrukynd, or mitapivat, in thalassemia to December 7, 2025, following submission of a REMS to mitigate hepatocellular injury. No new efficacy or safety data were requested. The filing is supported by the ENERGIZE and ENERGIZE-T Phase 3 trials and seeks approval in adult non-transfusion-dependent and transfusion-dependent alpha or beta thalassemia. Ferric maltol's pediatric expansion has received U.S. priority review. The supplement seeks a label extension to adolescents aged 10 years and older, with a U.S. decision anticipated in 2026. Plans include filing for patients 1 month and older using the oral suspension studied in the Forte-S Phase 3 trial, alongside a parallel EMA submission by Norgine, offering an option for adults unable to swallow capsules. Stay ahead in hematology and blood cancer research. Like, share, and subscribe for weekly updates. visit lqventures.com or email us at info@lqventures.com for expert healthcare consultants.